Hello, good morning everyone. Today we are addressing a critical issue, the under-identification of mental health issues in older adults. Despite the prevalence of mental health problem in this demographic, they often go unnoticed and untreated. Let's dive into why this happens and what we can do about it. We are talking about under-identification, societal and individual mental health issues in older people. So, societal and individual reasons are ageism, stigma, lack of awareness and education, limited access to mental health services, negative belief of the effectiveness of mental health treatment, communication barrier. As stigma and ageism, society often holds stereotypes about aging, assuming that mental health problems are a natural part of getting older. This can lead to the dismissal of symptoms or the belief that seeking help is unnecessary or even shameful. Lack of awareness and education. There is general lack of awareness and education about mental health issues in older adults among the public and healthcare professions. Symptoms of mental illness may be understood or overlooked. Limited access to mental health services. Older individuals may face barriers such as lack of transportation, financial constraints, or limited availability of mental health services tailored to their needs. This can prevent them from seeking or receiving appropriate care. Communication barrier. As older adults may have difficulty expressing their mental health concerns due to communication barriers, cognitive decline, or fear of being understood. We also have talked about individual reasons that are normalization of symptoms. Some older individuals may normalize their symptoms, assuming they are just a part of aging. They may not recognize the difference between normal aging related changes and symptoms of mental illness. Reluctant to seek mental health treatment, fear of stigma, denial, or belief that seeking help is a sign of weakness can prevent older individuals from reaching out for support or treatment. We also have cost of mental health services, cultural belief towards mental health may influence an individual willingness to acknowledge and seek help for mental health issues. And we also have comorbidities with physical health issues, that older adults may prioritize physical health concerns over mental health or may be more focused on managing chronic health conditions, leading to mental health issues being overlooked or downplayed. And we also talked about its strategy to mitigate on the identifications. They are increased mental health screening. We have to do routine mental health screening during primary care visits, focusing on common mental health issues like depression, anxiety, and cognitive decline. We have to do validated screening tools like the geriatric depression scale or the patient health questionnaire. 9-item version of the depression model can help identify symptoms of depression and other mental health issues and facilitate timely interventions. We also have training for healthcare professions. That training should include education on common mental health disorders in this population, as well as strategy for effective communication and stigma reduction, providing training in health advocacy, anti-stigma competency, social contact-based approaches be an effective coordination in reducing stigma and increasing mental health knowledge. We also do community outreach programs where we conduct outreach activities, support groups, and educational courses targeted to the needs and requirements of older individuals, which helps to maintain and strengthen then social interpersonal connection and relationship, enhancing a person's social interaction and activities. In addition, to provide psychosocial support to alter behavior and thought patterns. We also do destigmatization efforts, like we launch campaign by promoting education and awareness about mental health issues to reduce stigma surrounding mental health in older populations. We also do media campaign that involves this destigmatization efforts involve media campaign, educational materials, and community events that promote understanding and acceptance of mental health problems. We also do early interventions and prevention can reduce the severity and duration of mental health issues, leading to better quality of life. And for this, we have done implication for practice, that integrated care to improve access for older adults who may be hesitate to seek specialized mental health services, implementing collaborative care to ensure comprehensive and holistic care for older adults with mental health issues, involve family members and caregiver in the identification and management of mental health issues in older adults. Yes, today we have talked about on the identification of mental health issues and their strategies to mitigate that on the identifications and implication for practice. I think this presentation will be fruitful for you. Thank you.